This is significant. The preliminary CDC data suggests that we may be seeing roughly 20,000 more lives saved per year, which is a hopeful trend, but some say more work needs to be done to combat the overdose crisis. The most recent CDC data, which ends in April, is showing a sudden and hopeful shift in fatal drug overdoses across the U.S., the estimated number of drug overdose deaths continuing to decline to their lowest level in 3 years.
Naloxone being widely available is huge. Overall, the education is actually working, and the resources. We still need more funding, of course, but overall, it's working.
In the past 2 decades, more than 37,000 North Carolinians lost their lives to drug overdose. Chandler Pico was almost one of them, but now he's helping others in recovery as the state is seeing fatal overdoses drop by 20%.
North Carolina is doing a good job of really taking care of this issue. We could be doing more, but we are definitely doing something.
It's sort of this dichotomy between do we care more about people using drugs, or do we care more about people dying?
Colin Miller, who is the community liaison within the opioid data lab team at UNC Chapel Hill, says there could be a combination of things that are causing this decline, such as the usage of other street drugs. But they need more data and research to determine what's driving the trend.
It's good that it's happening, but it's kind of bad, one, that there's still so many deaths, and two, that we don't know why it's happening. So it's going to be hard to repeat it unless we really research what's going on and find out exactly why these numbers are dropping.
Now, overall, some good news is that the preliminary data suggests that the trend is continuing, but as some advocates say, more work can be done, especially funding for better addiction treatment and healthcare services. Reporting in Raleigh, Cindy Bay, ABC 11 Eyewitness News.